when we are raising kids and running a business and running our household and taking care of parents and like doing all the things that we're doing, that we pause and understand that pleasure that we release is so good for us in so many ways, lowering cortisol and increasing serotonin and endorphins and all those things that make us happier, healthier, wealthier, all those kind of things. So I wish women understood their body better and understood that they have the absolute right to pleasure and that it isn't unachievable, that there are lots of things that we can do to help them if they're struggling to get there.
Hello, Superwomen, and welcome to the Pleasure Principles podcast. I had the pleasure of being on Kristen's podcast, the whole shebang, and the conversation was so great. I had to welcome her here. So welcome, Kristen. Why don't you tell us a little bit about you and what you do?
Thank you so much. Honestly, Jordan, I loved having you on my podcast, and I cannot wait to hear what the audience has to say. I am a pelvic health physiotherapist by training. I've been a physio for over 26 years and really dove into pelvic health the last 10 years of my career. After I had some pretty significant pelvic things happening as well, and found that, wow, pelvic health physio really works. And so, yeah, I know.
Pelvic health physio saved me and my sex life.
Yeah, it's amazing. And from there, it's really interesting, actually, Jordan. I decided I was working for a national home care company and I was doing these big projects and I was traveling and it was burning me out, like in a way that I'm not an anxious person. And I was waking up Saturday in the middle of the night, like sweating about Monday, and decided I can't do this to myself. So I am going to go straight back to being a physio because I had been in a more of a director level at that company. And I started working as a physio just on my own. And I thought, I don't want to lead people. I don't want to be in that management role. And then within 6 months, I bought the clinic.
And then you were in a management role all again.
Exactly. So I own Blueberry Therapy, Pelvic Health, and Pediatrics in Dundas, Ontario. And then over the years, as women and entrepreneurs do, while I love the clinic and I like the clinical piece, I decided I need to do a little more. So I started a podcast, the whole shebang.
Same as me, yeah.
Yeah. And then last year, 2025, I hosted a women's sexual health conference called The Pleasure Principle. So we should have met about that, obviously.
I know. That's why so many people introduce. I think the third person that finally said to me, like, you have to connect with Kristen. And we did.
Yeah,
we did. It was meant to be.
It was truly meant to be. So that's who I am.
I love it. So I know my opinion, but do you think that pelvic health and pelvic floor physiotherapy has become less taboo, more accessed in the last 5 years, 10 years? Because I know when I was originally looking for support with pelvic pain, there was that didn't exist. I was misdiagnosed for years. So what are you kind of seeing as the trend?
I think you nailed it. I think the last 5 years, there has been a definite push in the late 20 to 30 odd year old group to access it. So when I first started the clinic about 9 years ago, I actually had to do a lot of educating to the public to let them know that pelvic health physiotherapy is a thing, that if you have issues with peeing, pooping, pain, sex, that there is some help through a physiotherapist. And then not only that, but educating to the larger healthcare community that pelvic health physiotherapy was a thing. And so I find over the last 5 years, we have much stronger patient advocates who are saying maybe they are seeing a doctor and the doctor says, well, I don't think anything can be done. And they might say, well, could I see a pelvic physio? And they are the ones that are leading the charge.
Yeah, don't you love it when as women we have to be our own advocates for health?
Oh, yeah. And I see it in my clinic every single day. Like whether it's my clients or my staff are coming to me and saying, I think this person that I'm treating needs X, Y, or Z. how can they get it? How can we advocate? And we have to know our body better than we know our body. We need to know what resources are available, and we need to be relentless in the pursuit of those because we could be really shut down in many different ways, even when we know that those resources exist and there's evidence to support many of these resources. So we have to be strong in our conviction.
Yeah, well, and that's the thing. We have to be our own advocates as women, and medical gaslighting and misdiagnosis is the reason why I became a naturopath and why I do what I do today, because it happened to me and I felt so alone and so ashamed that I didn't want any other woman to feel like that ever.
Yeah.
And I mean, it's definitely kind of backwards. And because there's probably women listening, and especially my clients would have the super trait of tolerance where they would just tolerate or just think this is the way that something is. What are some of the signs that a woman has pelvic floor dysfunction? Maybe even if she's not peeing herself, but like what are signs that she should be seeing a pelvic floor physio?
I absolutely love this question, and I mean, if I just back it up to I actually am really a big advocate for I think all women should see a pelvic physio regardless of signs, because we actually know that 50% of women who have had a baby will have some degree of pelvic organ prolapse. We know that 50% of women will identify as having incontinence, whether it be urinary or fecal, some or a lot of the time. And we know that as we age, it gets upwards of 40 to 60%, depending on the literature you look at, have pain with intercourse, or even just they don't feel very much at all, so they can't orgasm. So if you think about all those 50%, most women will end up with some type of pelvic floor dysfunction. And so for the people that are listening, that might be that you have heaviness and pressure in your pelvic area. It might be that, your body feels different. You're in the shower and you're washing and you notice, that it feels a bit spongy. That could be your pelvic organs descending. It could be that you have groin pain, pubic pain, even some hip and SI joint. So that SI joint is at the back of your pelvis, kind of that bony structure. That could be that the pelvic floor is not functioning very well. So those are some of the signs. And then certainly people that have endometriosis diagnosed, PCOS diagnosed, people that have had C-sections or hysterectomies or have a lot of scar tissue in the area, it is likely that the pelvic floor is not working optimally. And then moving on to the frank pain with sex or leaking, really sustained low back pain, you've done everything about it, then it could be that it's a pelvic floor issue. So there are lots of different reasons you might see a pelvic physio. Constipation is another one. You just
I
don't
know
have.
that was the one I was
Yeah.
gonna I didn't want to interrupt you, but I wanted to say like, and constipation, because that's a big one, and especially with the high functioning women that I work with, they are tense. They are probably not drinking enough water. They are not taking enough bathroom breaks. So they sort of have this like functional constipation. And that's the other thing that it boils my blood after 12 plus years of treating women clinically is, oh, well, I poo once every 3 days and my doctor says it's fine. Like it's normal. And it's like, okay, might be normal for you, but that is not optimal. And when we're headed into perimenopause and progesterone's dropping and we need estrogen clearance and you're only pooping once every 3 days and you're bloated. And I know if I miss 1 day of pooping, I feel miserable and bloated
Yes.
and not sexy. It's just like, how is this? And yeah, the underdiagnosing of PCOS and of endometriosis. I feel like it's improving, but
Mhm.
oh my goodness.
It's improving though because women are advocating more, just like you said at the beginning. And on the note of constipation, I think when I first started practicing in this area, I would say, do you suffer from constipation? And to a letter, people say no. And then you say, Do you have a bowel
How
movement every
often?
day
Yes,
or
that is
multiple
my
times a day?
question on my intake. It's not,
Yes,
"Are you constipated?" Because they will
exactly.
always yes, our standard is off, and they don't even know. And then they also don't even know I'll ask, "Are you bloated?" And they'll say, "No." But it's
Mhm.
because they don't know what it's like to feel not bloated, right? It's
Totally.
just that's their baseline. Their baseline is bloated,
Yeah.
full of poop, stressed out, and,
And be
like, in tolerating pain.
Totally, and because I'm a pelvic physio and I ask those questions and still they'll say, "No, no, I'm not constipated," and then with consent, most times a pelvic physio, we do that internal vaginal or rectal exam, but in the internal vaginal, you feel the poop. So they'll have said, "I'm not constipated, I have a regular bowel movement, I evacuate well," and then, there's hard evidence, literally hard,
Yeah.
that
It's like,
that they are
"You're full of shit, I can feel it."
exactly. Yeah. So we have lots of conversations about how to have a good poop, and I send them to naturopathy all the time to really work together on that. But some of these people too have had issues with pooping since they were 6, 7 years old. So it truly is their
It's
normal.
literally their normal.
Mhm.
Oh, yeah.
Mhm.
Yeah. I know. I know. Or heavy periods or painful periods or pain with sex. Like, we've normalized dysfunction for women across the board.
Yeah.
And yeah, that was kind of my first my
Yeah.
first mission. I was like, we need better quality of health for women." And
Yeah.
now it's like we need better sex and health, but it's all the same.
It's
Sexual health
all
is
connected. Yeah.
health. Yeah, for sure. Are there any other myths about pelvic floor or pelvic health that are still being taught?
I think one of the things that people really think of, they think of their pelvic health. I'm having a baby. I'm going to go see a pelvic physio postpartum. And that's when you see. And
Which
I'm a,
that's better than but that's an improvement.
yes, it is. But one of the things I like to say to people is everybody has a pelvic floor. So while I know we are talking not only primarily to women on this podcast, but men require pelvic physio at times. People who are transitioning genders need pelvic physio. Kids need pelvic physio if they're constipated, bedwetting, have fecal incontinence, all of those kind of things. So I think we are doing a better job at recognizing postpartum pelvic physio makes sense, but we are actually more effective if we see people in pregnancy,
Before.
which makes sense, right? It's like you're going to have a knee replacement. You go and make sure the muscles around the knee are working really well before you have that surgery. Afterwards, when you're in pain and swollen and all that, at least you
Right, it
know what
helps
you need to do.
recovery.
Yeah. So I think the scope of which we can do, there's a bit of a misunderstanding about what we can do. I think the other thing is, I mean, sometimes physios are seeing clients 3 times a week, not pelvic physios usually, but orthopedic physios, and they're doing an adjustment. You're coming in, you're getting treatment, you're leaving. Pelvic physio is full of education, which I absolutely love.
Me too.
And
We love a handout, and I love that my pelvic physio gives me handouts and has, like, exercises and breathing, like, virtual
exactly.
folder.
Yeah. And so there's a lot of education. There's a ton of things that we can do and help you to understand your body. You go and practice it for longer time. So there's that expectation that you are doing a fair bit of the actual work yourself outside of your time with your physio. And then I think one of the other reasons I love pelvic physio is, of course, we're talking about muscles and we're talking about how the organs work and how all that, but there's an incredible connection between the brain. And we know people that hold all kinds of stress and are high achievers and are anxious and feel those shoulders rising up and have all kinds of tension,
And the
likely
jaw tension.
likely have pelvic floor tension too. And so, we're having all those conversations about how do you breathe? Do you integrate meditation and mindfulness? Are there ways, what is bringing joy in your life as a way of releasing and relaxing the pelvic floor. And that whole body piece is one of the things that I really like about how we approach people.
Yeah, and it was, pelvic pain and hormone issues that really got me into this to begin with, and then just my personal experience gave me very niche clinical knowledge that, I thought that there was something wrong with me or to
Mm.
have not 1 but 2 Bartholin cyst marsupializations in my teens and 20s, you know what I mean? Like,
Mhm.
anyways, that you realize how many women it actually affects, and it is whole body.
It truly is. And like I mentioned at the very beginning that I had my own pelvic issues, and that's what really made me aware of how valuable pelvic physio is. And when I went 26 years ago, when I went through school to be a physio, we spent literally 10 minutes on the pelvic floor. So a lot of the information and the way that pelvic physio has risen up is because there's more and more and more evidence. So I talking about constipation, I was that kid that I grew up in a really wonderful household, but my dad smoked, and every year I got a ridiculous cough. With that cough, I was on antibiotics every winter,
Mm,
and I think
I can see the setup here.
yeah, it just messed up the whole microbiome, and I was constipated, like, my entire teens and 20s, and I didn't even really realize it, and at 28, I had rectal prolapse, and, like,
Mm,
that was devastating to me. I didn't know what was going on, but I knew that, like, my butt was
yeah,
dropping
something was
out,
wrong.
and I had to do all these tests, and I came out of every test crying, like, what like, because it's just such a sensitive area, and anyway, ended up having to have surgery at 28 to repair, and that kinda started me thinking about, like, what is going on here, but then it took 2 more trips to a pelvic physio. One had my first son 21 years ago, and 2 weeks later ran on a treadmill, peed all over myself, and I just thought I was sweating like crazy, but
Why were you running on a treadmill 2 weeks after giving
because I
birth?
didn't know enough about pelvic physio, and I was like that high achieving, like, I was a runner, I'm getting back to running, this is
Yeah,
what you
look at
do.
me, I'm gonna bounce back.
Exactly, and then with my 2nd son, I in that nesting phase, I was, like, 8.5 months pregnant, I stood on 2 bar stools in my kitchen to clean the top of the kitchen cabinets, of which nobody will ever see, and they slipped. Oh, yes. And so
No.
oh, yeah. So I had lightning crotch, that slip of the pubic symphysis. I couldn't climb the stairs. I couldn't
And
put
that
my
is
pants
not what
on.
you want at 8.5 weeks pregnant.
8.5 months.
Or s ex I'm sorry, eight and a
Yeah.
half months pregnant.
Yeah. Yeah. So anyway, so I had a number of pelvic things that happened along the way, and I had pelvic physios that essentially fixed me each time. So I was a physio, and then I had this amazing pelvic physio treating me, and then I realized over and over again, "Oh my gosh, this stuff really works,
Yeah, this
and
is
there's
necessary.
this is
I One of
necessary."
my Bartholin surgeries was when I was 8 months pregnant,
Oh, yeah,
and
and
I had a
everything
vaginal delivery.
yikes,
Yeah, I was,
yikes.
like, determined that was not gonna stop me.
Mhm, mhm. But you think at that point, I mean, you're all swollen, you have more blood flow, you have more sensation, everything. Oh, that must have been
Oh,
sore.
it was yeah, it was a rough one.
Mhm, mhm.
Yeah,
So like, too, having had pelvic pain and all of those kind of things, I feel like I bring that both to my practice, to everything that I do because I have been there. I get that, and I want people to maybe not have to go through that, to not feel so much shame in what's happening with their body, to understand that there's a way forward, and on the other side, it can be really good, but I've been there.
yeah, definitely. And do you think that there's a connection between trauma, sexual abuse, and pelvic pain?
Without a doubt. 100%. Yeah, we just find that and actually, it's interesting that you say that because when I started the practice, I do an intake form that asks about different things, And the number of people that checked sexual trauma, sexual abuse, like it's probably 40% of our clients. And I suspect that is not actual. I bet it's higher than that because sometimes people don't check it, but then they will, as they become comfortable, start speaking with you about what's happened and how they notice, whether it be actual penetration and sexual abuse or
And
trauma.
that is what I find is the big issue, is because many people have experienced sexual trauma, sexual assault, sexual abuse, but it's how we define it. And it's obviously there's a much bigger conversation here, but around betrayal, blindness, where if we are abused, it is easier to just pretend it didn't happen and dissociate from it as a survival mechanism,
Yes.
people not being believed. But there's, yeah. And I need to remember the exact statistic, but the number of women that have had some form of sexual abuse by the time they're 12 is like 1 in 3 or
I think
something.
it's 1 in 3. Yeah.
And I think that's underreported because just the number of women that don't identify with that, or it was, oh, uncle so and so was creepy and would touch us, and it's just sort of like normalized in the ethos, but it actually is sexual trauma, and our bodies know. Like, that's my biggest thing, is that our bodies remember, our nervous system remembers, and we need safety as the foundation of pleasure. So if we don't have that and we're not identifying that we have had abuse or assault, and I didn't either, and for a long time, it probably took until I was in my late 20s for a therapist to say to me, like, "Why won't you just accept this identity?" You know? And I'm like, "Well, it didn't affect me." But here I was with pelvic pain and 2 surgeries on my vagina,
Mhm. Yeah,
you
and we
know?
and we definitely see it in the office. I mean, yes, there are those people that identify and people that, have had years of counseling and are able to kind of talk about it. There are other people that will say identify as they've had a sexual abuse or trauma. They'll say, I really don't want to talk about it. And then there are other people where they give consent for that internal assessment, and you can tell that they're dissociating in that moment. Like it is a really interesting thing as a therapist to be working and you're chatting with someone and they're suddenly not in that room. And that's something that we've been trained to identify and try and bring them back. But then there are other people too that like have very, very poor sense of what's happening in their whole pelvic region
Their
because
whole
they,
bodies.
yeah, yeah,
But especially their pelvic region.
yeah, yeah.
I'll ask my clients, like, "Can you feel your labia right now? Can you
Mm,
feel your vagina? What
hmm.
about your butthole?" And
Yeah.
no awareness or sensation in that area, and I remember being there.
Hmm.
And how are we supposed to have good sex and orgasms if we can't even feel those areas?
Exactly. Exactly. And then we have people that come and sexual abuse or not, just people that come to the office and say, you know what, I've never had an orgasm and I really want you to help me to understand my body and how it works. And knowing that the pelvic floor and quick rhythmic contractions contribute to that orgasm, pardon me. They want to know, how do we make it work? And I love that. Like, what a fun opportunity to help people towards something that's really pleasurable, joyful, and they're looking for a coach. I think those are amazing clients.
Yeah, we come at it from different angles, but helping
Mhm.
people have better poops and better sex,
It's all connected.
it's fun. It's
Yeah.
really fun.
Yeah. That blueberry therapy, our New Year's resolution for 2026 should be to have more orgasms. And part of that was based on some research that's been done with vibration and vibrators. And there's a 2024 paper that looks at if you're using a vibrator, even like 3 minutes 3 times a week, that you improve blood flow to the area, you improve how the nerves work to the pelvic floor. That can be with orgasm or not, but it helps you to connect with that part of your brain. That part of your brain is lighting up when you're giving it a little bit of attention, and that translates to so many good things if you can do that.
I love it. In my groups, we do like orgasm a day or pleasure
Mhm,
challenges, which the whole point is connecting to that part of your body and
mhm.
turning those pleasure centers in your brain on. Do you think I've asked a couple physios, pelvic floor physios, this question? Do you think that vibrators desensitize you, like, for orgasm without a vibrator? Because I have a lot of clients that'll come to me and they can only orgasm one way with a vibrator, one position.
Mm, I actually don't think that that's the case. Like, I do think so. One of the things that we see in terms of our nervous system is as we age, our actual sense of touch decreases, but our sense of vibration is better preserved. So that's one of the things that happens. And I think whether you're using your hand, something that doesn't vibrate, somebody else's hand, whatever, you are still interacting with the nerve and lighting that nerve up. And the more that brain area and the brain map of that area improves, the chances are that you should be able to orgasm through lots of different ways. I hear your point though, like, because vibrators get the job done quick and there are those pieces of it, but I think they can be a really nice tool, especially when people have had pelvic pain, to remember that
The
that
pleasure
that is an
side.
area that is
Yeah, it's
that
almost like
has
we're
pelvic.
retraining the
Yeah.
nerves.
And I think when I think about before, when I was younger and we had like a Fantasia party and people brought out these like crazy dildos, and they were supposed to be like really amazing, and yet, as you know, and I know you teach that, lots of that internal penetration doesn't actually provoke very much pleasure. And I think the vibrators and the ones that are air pulse, suck and blow the clitoris, all that kind of stuff, actually work on the way we feel pleasure. And I think that can be really empowering for people to know that this is the way their body works.
Yeah, I'm always big on a third of women orgasm from penetration
Hmm.
alone.
Yeah.
And working with that whole neural network. And that's I think that's better that more women are learning about different types that well, just even the availability of different types of sex toys that are suction or right? Because
Hmm.
what was the option before? Vibrator or dildo, and that was it. There
Yeah.
wasn't suction, there wasn't air. So, anyways, I'm loving that those are even options, and for
Mhm.
me, I'm a lot of women were healing their relationship to pleasure, and they don't even really know, like, do I like a suction? Do I like or and some hate suction, but some
Mhm.
love the air ones, and
Mhm.
it's skipping my mind what they're called. But
Just the yeah.
just the fact that there's options and that different type of sensation feels good, and sometimes different type of sensation feels good at different points of your cycle. Or,
Mhm.
what felt good when you were 30 is different when you're 50, as you
Yeah.
mentioned, because hormones change and nerves change, bodies change. It's supposed to be that way. So instead of thinking like, oh, there's something wrong with me, I'm broken, which is sort of
Yeah.
how we're meant to feel as women, then it can be this fun exploration of, "Oh, okay, this thing doesn't work for me anymore, or this position or this style, but what does?" And
Mhm.
then it can sort of be a way to introduce novelty into the whole thing.
For sure. And like in the practice too, we have a lot of women that have some degree of pelvic organ prolapse. And that just means the organs are dropping down a little bit and they get really concerned whether they can do anything down there. And I mean, what we know is if we're bringing blood flow and we are improving the tissue flexibility and lubrication, that we're helping with things. So I think that's important. And then even so now I carry a whole line of different things on our Blueberry Therapy shop. And one of them actually is this beautiful, it almost looks like a mouse for your computer. And it both vibrates, but it heats up or cools down. So it's all
I
external.
love temperature.
Yeah, and then you
Like,
could just
and
play. It
yeah,
can be anywhere. It could be anywhere on your partner or
yeah.
partners, and
Now even I don't want anything in me if it's not warm or like a
sure.
I've been spoiled now with the temperature toys because it's like it doesn't feel real enough for me. It's like, this feels plasticky, but it's warm, it feels more
Real.
natural, more
Yeah.
human. So, yeah, I love that we have these options. What do you wish that more women okay, 2 questions. 1, is there anything that we can do to prevent prolapse? Because I know that our listeners are in our hypervigilant brains, and we're going like, "Prolapse? I don't want prolapse," or "How do I stop it?"
Yeah, yeah, there are lots of things actually. So part of my push to have people see a pelvic physio even before they have children is to know, how is your pelvic floor working? Are you able to contract the pelvic floor as well as are you able to release it? So if you have a better understanding how your body works, then you go into potentially pregnancies or not, and you can make sure that you are doing all the best things to maintain like the bottom of your inner core, which is your pelvic floor. We also know that maintaining a healthy weight is really helpful to prevent all that pressure down on the pelvic organs. Staying out of constipation, that is really a big one because you think of pregnancy and vaginal birth as causing some prolapse, but if every time you have a bowel movement, you are pushing, there's the weight of the poop sitting on your pelvic floor for days, that actually can
Yeah,
cause
over
even
cumulative
for
over
years,
time for, yeah, decades is a
right?
big problem. Yeah, I never
Yeah.
thought of it that way. That's a great point.
And then also, I'm a big advocate for people to do weight training to maintain muscle mass, bone health, all that kind of stuff. But breath holding as your weight training can cause some issues too. So, yes, go and weight train and work with a trainer or figure out how to ramp up, but make sure you're not holding your breath as you're doing a heavy deadlift, a heavy deep squat, that kind of stuff. So, those are the things that are important. And then the other, I mean, as we go through different stages in terms of our hormone health, whether that be postpartum or that perimenopausal, menopausal transition, make sure that the vaginal canal tissue health is doing really well. And whatever that looks like to you, is it a vaginal estrogen? Is it a vaginal moisturizer? Are you using a vibration practice to bring blood flow to the area? So, tissue health, muscle health, staying out of constipation, no breath holding, weight in general, those are all things you can do to help prevent pelvic organ prolapse.
I love that, and I'm writing vaginal estrogen prescriptions daily.
Awesome.
Like, the the boomers, I feel like, and the Women's Health Initiative is an example of this is what happens when we don't have vaginal estrogen, and we need to correct that because they were
Mhm.
significantly underserved by not having adequate hormone.
Mhm. Can I say one more thing about, I just thought that I should have mentioned as well?
Yeah,
And
please.
that is, if you think you have some degree of prolapse, so you're in the shower and you notice a little something, or you have heaviness, you have pressure, as the day goes on, it gets worse, and you go and see your doctor and they lie you down and use a speculum and say you do not have prolapse, you probably have it. Because gravity is the hardest thing for pelvic organ prolapse, and speculums stabilize the vaginal wall,
Yeah,
so you
it's
can't.
literally like you're putting
Yes,
something in
you
there.
you're putting a support in there, so
Yeah,
don't accept that as the actual answer. Go see a pelvic physio, and then one of the things I'm doing is using vaginal pessaries, and I'm trying to really make people understand what a pessary is. It's just a support brace in the vaginal canal. And people always say, like, if I do this, is it going to make the prolapse worse? It's actually the opposite. There is research coming out now that if we support the vaginal canal, we push those organs up a little bit, that the organs are no longer stretching the ligaments and fascia that they would be if they're in kind of that lowered position. And so the use of a vaginal pessary at any point in your journey is a really amazing thing. I would also say sometimes doctors will say you're too young for a pessary, and sometimes they'll say you're too old for a pessary. None of those are right. A pessary is just a brace. You can use it a little bit. Maybe you're a runner and you want to use it then. You can use it a lot. You can use it if you're not menstruating or having intercourse. You can use it for 3 months at a time. It just stays in. So it can be really, really impactful, get people back to their activity and make them feel.
Which has massive benefits for overall health and well-being.
Exactly. It makes them feel like their body's their own, that they're in control again. So there are lots of things to either prevent prolapse or treat prolapse in a way that feels really good and empowering for you.
Thank you. I'm glad that you mentioned that last one.
Mm-hmm.
So last question from me. What do you wish more women knew about their pelvic floors?
Yeah, I mean, I wish they knew they had a pelvic floor. If we just go back to that. And I just so wish that women understood their body, understood that they have this beautiful clitoris, that the only reason we have a clitoris is
For pleasure.
And that with that pleasure, I mean, especially when we are raising kids and running a business and running our household and taking care of parents and like doing all the things that we're doing, that we pause and understand that pleasure that we release is so good for us in so many ways, lowering cortisol and increasing serotonin and endorphins and all those things that make us happier, healthier, wealthier, all those kind of things. So I think I wish women understood their body better and understood that they have the absolute right to pleasure and that it isn't unachievable, that there are lots of things that we can do to help them if they're struggling to get there.
Thank you so much for sharing all of your wisdom. Where can everyone find you?
Thank you for having me. This has been really fun. I can be found on Instagram. It's long, okay? It's Blueberry Therapy Pelvic Health. When I started the business and I wanted to do blueberry therapy, that was a lady making pies. So it's Blueberry Therapy Pelvic Health. And if people want to check out the clinic, they can easily go on our website, and that's blueberrytherapy.ca.
Thank you so much, Kristen.
Thank you, Jordan.